What's up, neuro nerds? So up until this point, all of my videos over different diseases and disorders have been central nervous system diseases and disorders, and I want to talk about Guillain-Barré syndrome in my next video, and that is a peripheral nervous system disorder. And so before I jump into peripheral nervous system disorders, I want to talk about the distinction between upper versus lower motor neuron signs and diseases. So this is the pathway for our corticospinal tract, and that is the tract that originates up in our motor cortex, goes down through the midbrain, into the medulla, and then eventually down into the spinal cord, and it's responsible for motor output. So in our motor pathways, there are two ordered neurons. So that's everything that's stringy and yellow. Starting up in our motor cortex, it goes down through the brainstem and into the spinal cord, and then it communicates with this green portion, which is our second order neuron, and it communicates in the anterior horn of the spinal cord. So after communicating with the second order neuron, or the alpha motor neuron in the anterior horn of the spinal cord, that's where the peripheral nervous system takes over. So these are actually the nerves, either the spinal nerve roots or the peripheral nerves that then innervate our muscles. So in short, you want to move. That's going to originate up in your primary motor cortex. It's going to send that signal down the spinal cord to the anterior horn cell, where that signal is going to communicate with the alpha motor neuron, or that second order neuron, and then that second order neuron is going to carry out whatever that movement is, whether it's flicking your finger or grabbing something or moving your leg forward and walking. In upper motor neuron disorders and diseases, there are going to be signs present that will not be present in lower motor neuron disorders. These signs include spasticity, which is an increase in muscle tone that is velocity dependent, that makes it difficult to move the muscles smoothly in the way that you want. Then you have weakness, which is difficulty or inability to move your muscles. Hyperreflexia is an exaggerated response to testing reflexes, so this would look like a significant or brisk kick with the knee-jerk reflex when they tap your patellar tendon with that hammer, or ankle clonus. Clonus is a rhythmic and involuntary muscle contraction. Babinski's sign is an abnormal response to stroking the bottom of the foot, such that if I took my thumbnail, went up the lateral portion of the sole of the foot and across the metatarsal heads, then I'm going to see dorsiflexion and extension of the toes. Hoffman's sign is when you tap the nail of the middle finger and then you get flexion response of all the other fingers. And then pronator drift is involuntary pronation, or turning downward of the forearm when the arms are extended out. So upper motor neuron disorders are going to be disorders or diseases that affect the brain or spinal cord. So stroke, brain injury, multiple sclerosis, spinal cord injury, ALS, and central nervous system tumors. So lower motor neuron signs would include weakness, fasciculations, which is like involuntary muscle twitching or contraction that you can actually see on like the surface of the skin happening to your patient. We've got atrophy, which is shrinkage or wasting of muscles. One reason we don't see that as much in upper motor neuron disorders is because it's very commonly paired with spasticity, and when muscles are spastic, they don't show as much evidence of atrophy. And then with lower motor neuron disorders, you have hyporeflexia or areflexia, which is decreased or absent deep tendon reflexes upon that knee-jerk reflex or that Achilles reflex. You can also have flaccid paralysis, which is loss of muscle tone and inability to move the affected muscles, and then also muscle cramps, which are just painful involuntary muscle contractions. So lower motor neuron disorders are amyotrophic lateral sclerosis, which I know I said was an upper motor neuron disorder, but it actually impacts both the upper motor neuron and the lower motor neuron. Then you have a more rare condition called spinal muscular atrophy, poliomyelitis, which has widely been eradicated in the US, but we're still seeing patients that develop post-polio syndrome as a result of having had polio when they were children. Guillain-Barré syndrome, which is similar to MS in that it causes breakdown of myelin, but in the peripheral nervous system, not in the central nervous system. And then Kennedy's disease, which is also called spinal and bulbar muscular atrophy. Thank you for taking a deep dive with me today on distinguishing upper versus lower motor neuron disorders.